Started 2 minutes.
Yeah, ma'am. Yes, ma'am. Next page. Ma'am, next page.
No, 2 pages only. First page, would you like to see the first page?
Yes, ma'am. Yes, ma'am. Can I start?
No, it's still last 1 minute. You can take time to organize your thought process.
Can I see next page, ma'am?
Started.
Hi, I'm Dr. Shaista, one of the doctors in the gynae clinic today. May I confirm your name and age, please?
Yeah, I'm Karen Dent and I'm 17 years old.
How may I address you?
Karen is fine.
Karen, are you in the school or you joined the university?
Actually, I am about to finish my school and will be going to university next year.
Next to know that, how is everything going on in the school?
Yeah, I'm actually means it's actually a tough time because the exams are coming in upcoming sessions, and I'm finding it little difficult because of this pain. Do you know, I have to miss my school, I have to miss my studies, and I do have sleepless night at a time. This pain is bothering me a lot.
I'm so sorry to hear about that. Yes, I can see you are here today because you are quite bothered because of this pain. So, do you have any other expectations apart from this problem?
I just wanted to know why this pain is there because I'm having this exam and I wanted to get relief from this pain.
Yeah, sure, Karen. I will discuss all your concerns with treatment options. But before that, is it okay if I ask you a couple of questions to know more about you? So finally, we can lead to
Yeah,
some. Mm-hmm.
yeah,
So,
that's good.
Seren, at the outset, I would like to know that whatever we will discuss today, it will be confidential. I will not disclose it to anyone else without your permission, okay?
Oh, yeah, thank you, doctor.
Mm. And few of my questions might be intrusive, so be with me, okay?
Yeah.
Could you tell me more about your pain?
Actually, this pain is there since last 7 to 8 months, doctor, and it has increasing slowly. It's a
Mm-hmm.
dull aching pain, constantly there, and
Mm-hmm.
it's now bothering me to the extent that I cannot able to study. It's affecting me very
All right.
badly.
I'm so sorry to hear about that. Do you need some painkillers, or would I
Uh,
continue?
no, it's okay, doctor. You can continue.
Mm-hmm. Can you score the pain for me? Zero is no
It's
pain,
very,
and
yeah, it's actually 7 or 8, always 7 to 8 on a pain score.
so are you on any treatment for that as you are suffering for last 8 months?
Yeah, I tried over the counter medications for a long time. Then I visited a GP, and he said that I should be starting on the COC pills. I was on that pill, but it hasn't given me any relief.
All right. So Did you notice anything which increasing or decreasing the pain? As you told me, medicines are not fruitful.
No,
So
I have
anything,
not
why?
noticed. No, I have
Any
not
problem?
noticed.
Hmm. Any problem with your water work and bowel opening?
No, never.
Any vaginal discharge?
No,
Hmm. Do you have pain anywhere else in the body apart
no,
from lower pain?
mhm, no.
Any link of this pain with your periods?
Yeah, initially my periods were not painful, but since last 6 7 months, it's quite painful. Actually, it's very pretty painful.
So does this pain increases with the passage of time during the periods, or it relieves when your periods are started? Any
No,
link?
it's there actually. After the period's gone, my pain vanishes.
Okay. So once your periods are finished, then are you quite comfortable?
Yeah,
Mm-hmm.
not actually. The pain is always there, but the pain during menses is another issue. What I'm having, what I'm suffering through.
All right. So is the flow is heavy
No,
and your periods are regular?
yeah,
Mm-hmm. Few of my questions might be interesting. Are you sexually active?
uh, not sexually active.
Mm-hmm. All right. And I have seen many candidates like your age. They have some problems in the childhood, like sometimes they have sexual abuse or emotional or some physical abuse. Would you like to share something like that?
Yeah, doctor, it was long back. Means I was a young child. At that time, I had a once or twice I had been abused by my known people. I haven't talked about it with anyone, and I hope you will not be talking about it.
I'm so sorry to hear about that. Your confidentiality is our utmost priority until and unless it is not threatening your life. Don't worry, Karan. It will be confidential. And moreover, do you have any medical problems?
No,
Any surgery in your tummy or down below?
no,
Are you allergic to anything?
no,
Do you smoke or drink alcohol?
no,
Pardon me for asking recreational drugs.
no.
Mm. All right, your weight and height ratio.
Normal.
Hmm. And your blood group.
I A positive.
Hmm. All right, any reservation related to blood transfusion?
No.
Any family history of concern, like endometriosis in your family or any problem in your family like you?
Yeah, my mother had endometriosis, and she had undergone a surgery for that. I'm worried about that also. Could it be endometriosis?
Okay, I'm going to discuss in a while. So how old was she when she is having endometriosis?
45. 45.
Mhm. Anyone else in your family members affecting by the same problem like endometriosis?
My sister was having some concern. She
Mhm.
was having difficulty in conceiving.
Okay, all right. And moreover, whom do you live with?
I stay with my parents. I am a school going
Are they
student.
supportive?
Yeah, they're quite supportive.
Mhm. Are you feeling low or depressive in last couple of
Not
weeks?
lower depressed, not lower depressed, but this pain is
Yeah,
a
I
big
know.
hurdle. I told you.
Mm. Okay, no worries. Help is always available. Thank you very much for the information. Would you like to add anything else? Am
No.
I okay? Kiran, I would like to check you in the presence of chaperone. My nurse will check your general well-being, and I will check your tummy to see if any pain on palpation. And I will check you from down, but you are not sexually active, right?
Yeah.
Okay. So now come to your concern. I can see you are alone today. Would you like someone to be with you?
No. You can go ahead.
Yeah. So, Kiran, the condition which you are suffering, I'm suspecting you are having chronic pelvic pain. Have you ever heard about that?
No, doctor.
Hmm. So still there is a possibility of endometriosis, but it is too early to say that it is endometriosis. But collectively, we can say this is chronic pelvic pain, and uh, um, and it is quite possible this pain if there are some problems if the patient they are abused or they are sexually active and they have some psychological problems. The pain is quite common, but we will not ignore you. There are quite investigations. We will rule out the possibility of other reasons, such as endometriosis and any problem in the pelvis with your womb or your ovaries. We will investigate for that. Would that be okay?
Okay.
So you will be managed by our expert team of health specialists, including my consultant, our counselor. We will involve the psychologist as well, and a skin doctor, and the GP and support groups. If you want, we will involve. Would that be okay?
Okay.
Mhm. So, as you told, you are on oral contraceptives. So they are. You told me they are not effective, right?
Yeah, I'm not getting any help, doctor.
Okay. So the patients who are having endometriosis, they usually get benefit from um, this oral combined pills.
Hello?
But
Hmm?
hello, yes, ma'am. Am I audible? Hello.
Hmm?
So I'm going to send few blood tests to see if
Hmm.
there is any infection. We'll check your blood strength and any infection in your blood, which is the reason for your pain. There are quite
उद्या
reasons for.
स्कॅन करूया ना बघू उद्या स्कॅन करू बघू हम्म.
Hello.
मी तुला थोड्या वेळाने करते ना फोन डिटेल मध्ये विचार सॉरी डिअर हा
No worries.
last 2 minutes I will be giving you because I couldn't hear you.
Yeah.
um,
So there are quite reasons for this problem. There are gynecological and non-gynecological pains, like as I told you, sometimes psychological problems, neurogenic pains, and some problems with the bowel and urinary tract. But um, endometriosis is quite possible. But I am going to send your blood to check the strength of the blood and is any infection in the blood, and we will check your urine as well, and we are going to do your scan to see is there any clue related to endometriosis. But after taking your history, it is not quite possible that you are having this, but after the scan we will guide you further about this condition. Are you with me so far?
yeah, doctor. Oh, yes, you told me what how you're going to go ahead. But can you just give me a relief so that I can appear for my exams?
Yeah, no worries. I'm going to give you some pain relief medicines. You can continue your combined pills, and we have alternative to combined pills like progesterone medicines. These are also effective. So I am going to write those medicines, and I am going to give you the leave. So if you have any problem, you can take off from your school for some days and you can prepare yourself at home. I'm going to put you in touch with a psychologist as well. You will be relieved after talking to him. Would it be okay?
Yeah, doctor, that is okay. But I'm not that keen on starting on any hormonal pills. Is there anything else?
Okay. In that case, if there is, yes, there is, if there is a clue on ultrasound, then surgery is also possible, which could be diagnostic as well as therapeutic, which we called laparoscopy. This is a keyhole surgery, but is a last resort to rule out the endometriosis and treat the endometriosis at the same time. But I would like to mention you that this keyhole surgery is there's a possibility of negativity of this procedure in 1 out of 2 cases. Means it is quite possible that we are not getting any reason for your pain even after this in less invasive surgery.
Okay.
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 Okay, so I can see I have given you a lot of information. These are some information leaflets related to your condition. You can go through them. I'm going to put you in touch with the consultant, the support groups, and with the psychologist as well. That be okay?
Okay. Yeah.
Thank you very much.
Thank you, doctor.
Thank you.
Thank you. Okay. Your reflection regarding your task. Time management is one issue, but okay, we will discuss in detail. Can you just reflect what you wanted to say about your own performance?
At the end, I was a little bit confused whether this is endometriosis or something else. But I only got one clue that maybe this is chronic pelvic pain because of sexual abuse in her childhood, and still there is a possibility of endometriosis because her mother and sister
So
both were.
that is, yeah. So we will rephrase that sentence in a different way. Okay.
Right.
Okay. But apart from that, what is your positive? What is your negative?
Hmm. Positive, maybe according to her age, I was quite means, I handled tackled her according to her age. Is she
Yes.
17 years,
Yeah.
and
Yeah. Yeah. Good
and
rapport building. Good communication skill.
yes, and the negative. I couldn't solve her problem because she was not interested in hormones. So at the time I was confused. What shall I give her?
Hmm. Okay.
Mhm. That was my problem because that's why. Yes, ma'am. This is the last point.
Okay. So my feedback on your task is time management, dear. Okay.
Yes, ma'am.
Yeah. So your history taking took almost 7 minutes 30 seconds. So your main task you were having only 2 minutes 40 seconds. If it is going to be the scenario, you will not able to complete your task. Hmm?
Right.
Uh, yeah. So whenever means there are important irrelevant points where you can cut short your history taking. Okay. Uh, so I will say that most of the history was pretty relevant, but still you need to ask a open question in the beginning. Set your agenda crisp and clear, including your aim also. Okay. Definitely, this is a teenage patient, so you need to ask 1 2 questions regarding herself, so that you will develop a very good rapport with the patient. That you developed, you could have cut short because you asked me 3 4 questions when you asked me the teenage format. Okay. Uh, so 2 questions is sufficient enough because ultimately we have to complete the task. In teenage patients, I always say that you enter into the station by asking them their name so that initial hesitancy goes down very fast. Hmm?
Right.
If I would have been there, I would have said, "Hi Karen, how are you?" Uh, and then you introduce yourself. Karen, I am Dr. Prajakta, one of the doctor in the gynae clinic today. Uh, how's your school going on? Then I would
Yes.
have come up, okay. And what about your studies? Okay, 1 or 2 questions, and then straight away go into the task because you had introduced rapport built, assured her about confidentiality very nicely, and then you go into the task. In the task also, since you had lost few important seconds in the beginning, aim and setting agenda will be very clear. Hmm? I have a GP letter who also mentioned about your pain which you are getting affected very badly, hmm, as per your GP letter. So can we discuss it in detail? Will it be okay if I ask you some questions? Few of my questions will be very sensitive, and I will ensure that we will ensure confidentiality throughout this consultation. Okay.
Okay.
So this is very quick means not having a long sentences where you will be taking too much time. Hmm?
Yes, ma'am.
Then the first question will always be open, which you missed out. You asked me regarding my concerns. You asked me my expectations. Okay, I wanted to get rid of this pain so that I can go ahead with the exam, which is coming up. See, it is not acute pain, so you could have not offered, means it's okay if you could not have offered me any pain relief. It's not an acute pain. I'm having this pain since long.
Yes,
Okay,
ma'am.
yeah. So that is one thing. All right, too many times. You can minimize that all right. Just
Okay.
nod your head, not even okay. This will minimize your 30 second. Okay.
Yes.
Then treatment tried, you asked me. Bowel bladder, vaginal discharge, you asked me. Uh, Dysmenorrhea, you asked me. Okay. Abuse history, you asked me. Straight away, you entered into that sexual history. In teenage format, lay examiner might not like it. Okay. So here, are you seeing someone right now? And are you in sexual active? Are you sexually active? Or if yes, then are you planning to get? If no, then are you planning to uh, go for sexual activity in upcoming days? Okay. Are you planning to have sexual contact with your partner in upcoming days? Something like that. Because as of now, she is not. But what if she will be having in upcoming days? Yes or
Mhm.
no? So
Yes.
contraception, yeah, contraception is very important. Safe sex practices is very important here. Hmm? So that one question, always ensure that you will be. Uh, Smoking, alcohol, drugs. See, straight station, you can skip also. Still, I will say okay. Why blood group, BMI, and Jehovah Witness? Why?
I thought we would opt for laparoscopy. And
Oh, no,
oh,
laparoscopy is not the first line. It's
mhm.
always the next line of modality, no?
Yes, ma'am.
It is the last option. Everything has failed and the pain is not going, then it is the last option. Okay. So
Yes,
not
ma'am.
the first option. So very nicely you elicited the history, but this is your drawback. Okay. So this
Mhm.
history could have been avoided so that
Mhm.
the relevant history you need to finish it off within 4 minutes.
Right.
Hmm?
Yes,
And see, here the GP has already mentioned since how long she is having the pain is interfering. So that means it is affecting her quality of life. That I was telling you. You paraphrase that. You acknowledge my concern. You empathize with my that symptoms also that I am suffering a lot. Uh,
ma'am.
what she has tried that also he has mentioned. Okay. And COC, I told you that I had tried, but now I am not finding it at ease. Then the management plan, okay. So in the management plan, yes, endometriosis is one differential diagnosis. Chronic pelvic pain, yes, could be because of many reasons. The chronic pelvic pain is not only because of the endometriosis or
Mhm.
psychological abuse. There are many reasons to have this chronic pelvic pain. Either it could be associated with the bladder, either it could be associated with the bowel. Okay, so you need to ask, and you asked me regarding bladder and bowel symptoms, vaginal discharge. Okay, some infection or some abuse. Abuse is psychological, but any infections, scar tissues in your lower tummy, lower abdomen, so that might be another issue. And then uh, dysmenorrhea or something like endometriosis. So endometriosis, less likely it will be endometriosis as it is not cyclical. It is continuously, na, continuous dull aching pain I am having, and I'm experiencing pain during menses also. So that is dysmenorrhea. But you can hear the sentence if I would have been at your place. Yes, there is a very strong positive family history of endometriosis in your case, but as of now, I am less likely expecting this as a differential diagnosis.
Yes.
But we need to rule out this also. So what we are going to say? We are going to offer her investigation. What investigation? The first investigation will be a pain diary.
Mhm.
See whether there is any changing pattern or what. Okay, along with that urine routine, along with that swab and TVS. Sorry, not TVS, but ultrasonography. Okay.
Ma'am,
Yeah.
if she was abused in her childhood, so can we do her PV examination and
No, no,
she
no, no.
yes,
Not PV examination. Sorry, no TVS. It's abdominal scan. No TVS, no PV examination. Swab, if you can say that if it is, if there is any infection, you can just take a external swabs.
yes.
No examination needed in this case. It is only uh, discussion of pain, but still you can say per abdominal examination and per local examination to see whether there is any pain, tenderness, mass. Okay, you can offer her examination. No harm in offering this patient examination.
Yes.
Okay, now coming to the next thing will be. um, Whenever you wanted to explain her the differential diagnosis of chronic pelvic pain, you can take a help of drawing. You can show that this is bladder, this is uterus, this is rectum or bowel. So anything, these are the organs which are there. So any means anything can cause a pain. If it is endometriosis, it will be from the uterus. If it is associated with bladder or bowel, then also it will be giving rise to pain in your lower tummy and will be affecting you very badly. Okay, so you can draw at that time. And then completed the task, you give me a plan where you had offered me MDT, pain management clinic, and offered me COC. I just wanted to see, listen to from you. I said no, I don't want COC. Why you don't want COC? Okay, you need to ask. Whenever the role player will say, I don't want that, please try to ask why he is not keen. And in her case, what do you think? If she is planning to get sexually active in upcoming days, then COC will also act as a
Contraceptive.
contraceptive. So it's a double benefit. Not then SSRIs. If not, then SSRIs. Okay, because she is not keen. So okay, if she is not keen, then we can offer her the antidepressant, that is SSRIs. There might be some side effects, but they are the tablets which will work in her case. If it is because of the abuse related pain, if the pain is associated with the abuse related issues, okay, so that might help her to relieve her pain. So that is my answer key.
Yes.
And laparoscopy will be the last option in her case. Before that, she will be offered counselor, pain management clinic, MDT, and everything. If failed, then laparoscopy will be the last resort, not the first resort. Yes.
Right.
Okay, so this will be my answer key, what I had mentioned. Introduction, since it is a teenage, I always ensure that I will be addressing them by name. Hi Karen, how are you? How's your study going on? Good to know that you are enjoying your school days and looking forward to enrolling the college. All the best. This is one question, okay? That means I have builded a good rapport with the patient. Set agenda and aim. So, Karen, I have a aim and setting agenda, okay? I have your GP letter which states that you are suffering badly from pain in your lower tummy and it's not getting relieved by usual medication. And for that, I'm going to ask you certain questions about your pain and discuss possible causes and measures to minimize it. Single line, keep it short. Okay. Concern, I had not asked here, but yes, we are going to ask her any specific concern she is having. So she is having a concern because of this pain. She might miss out on her upcoming exam. So that is her biggest concern and she wanted to get relieved. Can you just tell me in detail about your pain? Its relation in food, bowel, bladder, any cyclic pattern, what makes it better or worse? What treatment have you tried? Any relief? No. Menstrual history, regular, normal, but yes, recently it is dysmenorrhea. Bleeding heavily? No. If she would have been bleeding heavily, then at least we can say, okay, it might be a endometriosis also. So then the strong possibility, okay? Otherwise, this is simple dysmenorrhea, what she is having. Sexual history, signpost, assure her about confidentiality, and then, are you seeing someone should be the first question. Then only ask if yes, are you sexually active? If so, what contraception and STI, any history of sexually transmitted infection. Take an opportunity to discuss about contraception and condom if she is sexually active. If not, and are you planning to get involved sexually in upcoming days, then also you can just ensure this is patient safety, that okay, please practice safe sex practices. Okay, any history of abuse, you asked, and ongoing abuse, you have to also ask whether there is any ongoing abuse, any flashback, anxieties. If it is so, I would like to need involve my senior or safeguarding team if there is any ongoing abuse continues. Hmm? here it is not, here it is not. Okay, so yes, you will be saying that please come up anytime, at any time if you are experiencing similar situation. Do you want to do you want to help from the counselor? Whenever the patient is saying something regarding abuse, ask her about a mental history, flashback and anxieties, and offer her counselor if she is having any concerns at that time. Any history of depression and self harm. If there is a history of depression, then self harm, that is a mental history. Now this is your main history. If you will be seeing, this is your main history which you had completed. Now quickly take her to, are you fit and fine, any surgeries on your lower tummy, any family history, okay, specific of endometriosis which you could take, any allergy, fear for endometriosis and hysterectomy is my concern. I have not asked here smoking, drinking, alcohol, because a straight patient coming to you, straight simple task, I will not take it in other way. Still smoking, you can ask. Alcohol and drugs, I don't feel this is they will make it too complex for you, because they wanted you to go in a straight direction. So let's see, okay. If you're having time you can ask, but if you're thinking that your time is running out of thing, then you decide what whether you wanted to ask or not.
Okay.
Okay, do you wish to involve your parents in your treatment? This is whenever the teenager comes up now, this one question you need to ask, whether you would like to involve your parents in your treatment. If yes, okay. If no, still okay. Yeah, this is one important question which you need to ask them. You offered me examination, local exam, PSPV will not be offered to her if she is not sexually active, but there is a history of abuse, dear.
Mm. Yes,
Hmm?
ma'am.
So any ongoing vaginal discharge, and if there is any discharge, we will take a swab. Okay. Looking at your symptoms, your pain is long standing, and in long standing pain, we label this pain as a chronic pelvic pain. Have you heard about it? Checking my background knowledge. Okay, checking my background knowledge. 1 out of 6 women in general affected by this kind of pain. It could be. Now here you can take a opportunity to draw a diagram, bladder, uterus and bowel. A lateral view you are going to draw here. A lateral view, okay? Either bladder, bowel or a uterus. And since there is a strong family history, a history of endometriosis cannot be ruled out, but I am suspecting that it is less likely in her case as of now. Hmm? And
Yes, ma'am.
yeah, along with this, as there is a history of abuse, sometimes this might give some emotional disturbances, some psychological issues, and could be the reason for her long standing pain. So it's a treatable condition. Please reassure her at this point. So maintain a pain diary for next 2 to 3 months, so that we will see its relationship. Further investigations will be USG, urine swab. Okay, these are your further investigation. Depending upon the type of pain, there will be a multiple options which will be offered to her. Initially, it might be a simple talking therapy and counselor. Hmm? Counselor and talking therapy will allow her pain to ease out. Okay, they will discuss certain coping therapies, coping strategies, and strategies to manage her pain. Although you didn't get relief from your COC or on contraceptive pill, but they can act as an ongoing contraception if you are planning to get sexually active in upcoming days. Okay.
Yes, ma'am.
Yeah. And if you are not keen to continue COC, then there is alternative medicine which is known as antidepressant, which modulates pain, okay, which helps to modulate a pain sensation. In most of the cases, this can be considered in her case at a low dose. Okay, so I can prescribe you that medication for low dose in up for some time. Yes, side effects are there like dry mouth, constipation, blurring of vision, but generally they are tolerable. Less likely endometriosis, and if it is at all endometriosis, then hysterectomy will not be required in her case. Most of the time COC will help her to get relief from her pain. Most of the patients with CPP will relieved with these measures, but if no relief, then the MDT approach will be formulated and we will involve pain management experts. Okay, where GP consultant, mental health specialist will be involved to tackle the pain in a better way. Sometimes we may have to take a help of MRI, and lastly it will be a keyhole surgery. If everything failed, then not as a first line of treatment. So we are not going to discuss here in detail about keyhole surgery. That will be the last thing. Okay, she is a 17-year-old, so here MCA will not be, and we will not need to discuss MCA. But if it is less than 16 years, then we can just ask her. So can you just repeat me what we have discussed up till now? This is one important question when the age is less than 16 or less than 16, and close the loop. So can I document whatever we have discussed? I will be documenting, writing back to a GP which you forgot to do, and will offer investigations along with pain diary. And with this counseling therapy, antidepressant or SSRIs, will follow you up after 3 months with my consultant. How does that sounds to you? Yes,
Yes.
doctor, I'm happy. I'm happy to go ahead with that. Okay. And a patient information leaflet of chronic pelvic pain. I had not mentioned here patient information leaflet. Okay.
Yes, ma'am. Thank you so much.
Yeah. So now go to the domain wise scoring. Rapport building since teenage. Very nicely you build a rapport. It was supportive, sensitive, non-judgmental approach throughout, explaining me diagnosis in lay language, providing support and counseling. Negotiation plan. Although I'm not keen on COC, but you could have emphasized more on COC. That is negotiation plan here. Okay. Checking understanding at a frequent interval, inviting questions, appreciation at times, signposting and apologies for abuse history, offer parental involvement. This is very important here. Huh? Offer parental involvement in teenager, addressing her concerns and fear. Okay, most of the points you have done very nicely. Interpretation of GP letter and acknowledging the information, relevant history, taking of pain, onset, duration, progression, bowel, bladder, menses. Okay, treatment history, prospective pain diary, interpretation to formulate differential diagnosis, come up to a working diagnosis. So upcoming days you have to offer her pain diary so that you will come up with the type of pain, pattern of the pain and association. Concern, fear, expectation, history of abuse, contraception, STI, offering USG, urine investigation, offering examination, effect on quality of life. So most of the points you were able to do. Information gathering was very detailed in your case, but that irrelevant history of information gathering will minimizes your mark. Okay, this will not give you mark. Patient safety, okay. Confirming patient identity is very important patient safety point. But the next question, rule out ongoing abuse. You have not asked whether there is any ongoing abuse. Counselor, you offered. CBT, you didn't offer, okay. Psychiatric, mostly psychiatric cause of her pain, okay. You mentioned this, but CBT is very important. That is talk therapy. Safeguarding, you mentioned. Confidentiality, you assured. COC will not ease out pain, but effective contraception if she is planning sexual intercourse with her boyfriend along with condom. Yes, this is very important. Always take certain sentences in action. Reassurance, prescribing the safe treatment, medical treatment like SSRI. You can very safely prescribe in her case. Although the first line of medication will be COC. Surgical management less likely needed in her case, that is lap surgery, because it is the first encounter. So if everything fails, then only surgical line of management. Negotiation for medical line of and not offering or not rushing for surgery. Understanding limits, when to involve SR, when to refer to specialist and MDT. Assessing mental capacity if less than or equal to 16 years. Here she was not, so it's okay. Differential diagnosis and especially non-gynecological causes. Appendicitis, okay, but appendicitis is acute. This is chronic pain. Bladder and bowel symptoms or IBS and IBD, these are the symptoms associated with chronic pelvic pain along with intestinal cystitis. But this age is not the age to get presented. Less likely endometriosis has no cyclical pattern but at risk of endometriosis due to strong family history. This is applied clinical knowledge. Possibility of psychological cause due to past history of abuse or scar tissues due to untreated past sexually transmitted infection due to abuse. Advised against laparoscopy as first line of modality. So this is a very means you had mentioned about this third point, psychological causes. Okay, differential diagnosis, you just mentioned two, psychological and endometriosis. You have not given me any differential diagnosis here. So applied clinical knowledge, I will give you borderline. Patient safety, I might fail you. Information gathering and communication with patient and relative, I will pass you. I will clearly pass you.
Thank you so much for the critical evaluation.
Thank you.